we lived in England for a year, and we were under the NHS, and we loved it. And we talked to a lot of people, because a lot of our American friends talked about, oh, well, they pay so much in taxes, so they're really paying, but it's not true. Like, we have friends that that are our age. They have a little boy. She has asthma, and so they take that into account into how much they pay into the National Health Service. So they pay a certain amount every year, and what they pay is far less than what we pay in our premium every month. And she was just shocked that I had to pay to have a baby. Like, she asked me, like, because when we were over there, we had Henry. He was a little baby. And she's like, so I heard you have to pay when you go to the hospital to have your baby. And I was like, yeah, we paid X amount of dollars. And she could not believe it. Because when they have children over there, you don't pay for anything. You go to the hospital, you get your anesthesia, you get your epidural. They don't do epidurals as much over there. But you do the whole thing and you don't pay for it. You pay for it in your taxes. But they're paying, like I said, less than our premiums. And I know that there are people that have had bad experiences, like not getting into a doctor right away. And it's another thing that a lot of Americans do not understand. They think that you wait forever in the emergency room. And I waited 4.5 hours in an emergency room in Utah. And I had to go to the emergency room in England, and I waited 30 minutes. So it's just the same. Like, there's no difference that way. And so it's really frustrating because, like, Amy pays £8, so like $12 for her, asthma, the inhaler. That's the standard. You will never pay more than £8 for a prescription. So I can't even imagine only paying $12 for insulin. I can't imagine that. So anyway, I get really upset when people criticize socialized healthcare, because in doing it the right way, socialized healthcare is great, but it has to be done the right way. So anyway, there's my political high horse right there. I just can't imagine only paying $12 for insulin instead of, $100. And I think the thing to remember is when, like, the way that the NHS works, like, Amy pays more because she has asthma. So, like, her taxes every year, she pays a little bit more, because obviously she's costing them more than, like, somebody with no health conditions would. So we would pay a little bit more because Henry has diabetes, right? Because obviously in the long run, we'll cost the NHS more money than a family without a chronic illness. So if you have, like, breast cancer or something like that, you're going to pay more in your yearly taxes. But it's nowhere near what you're paying here for your insurance, your premiums, your, like, a hospital stay, all of your prescriptions that you need, yada, yada, yada. I mean, you're still paying money, but it's not, anyway. It's just, socialized healthcare done the right way would save a lot of people a lot of money and a lot of stress. Done the wrong way, it increases a lot of issues. So anyway, I think our country has a lot to learn and a long road until we get there. And I'm not saying that NHS is perfect. It's not. It's not perfect. And like I said, I did have some friends who struggled to find, good health care for a specific need. But, they have a little bit more experience than we do. So